Okay, so this is, something fascinating, talking about saddlebags here. So she's going to be having a skinny BBL, obviously, because she's thin. A skinny BBL is patients that are thin and they just have enough fat in order to have a BBL. I think sometimes people are interpreting skinny BBLs as like a light BBL, or they don't want too much fat injected or something, but that's not what it is. A skinny BBL are patients who are very thin naturally and they don't have a lot of fat, and so we have to be very strategic and as to where we place the fat, and be very careful with how we use the fat. So that's kind of what we're working with here. I think she's got enough fat, but like just enough fat. So I'm gonna have you turn around, because I don't really want to talk about the skinny BBL. What I want to talk about here is the saddlebags. And so it's really always amazing to me how patients can be so thin and yet they do have fatty deposits. And this is a perfect example of one right here, where she has this saddlebag. It's a terrible name, but I don't know, that's really all we have to go by. And she has this fat here, and she'd asked me if maybe we could take it down, but I wouldn't at all, because we're going to use this fat. I always think of this area when patients come in with this fat in this area is like somebody's coming to your house and they bring a really nice bottle of wine for dinner, and you're like, wow, that's just, you're such a good addition to the dinner party. You're the same way. Like, you're bringing this fat here, that's a really good addition to the BBL party. So her main concern, and what we're going to focus on, is filling in this hip dip here. And that's why she has enough fat, because we're not looking to do a complete, making her butt as big as we can. She's really more focused on the shape. And so I'm going to build out this hip. I'm going to use this fat in that I'm going to blend into it. So I'm going to add fat here to blend into the leg, so that this line, as it comes up, instead of being flat and coming out, it's going to just be more smooth. So everything is just about this Ogee line, and this is the convex part. So I'm going to add fat here, and I put an X here because I'm not adding fat here. And the easy thing to do is add fat here because it's nice and soft and it would just blow up, but it would really disrupt her line. So what we want to do is put fat here, which is going to be harder because this is tight, but we'll be able to get a little bit of fat here, and that's going to, instead of being flat here, it's going to blend into this saddlebag area. And then I'm going to backfill all of her hips and blend with this, so this line will just come up and be really nice. And then this is all going to get removed, so that's the concave part of the Ogee, because that's a key area. So I'll show you in the OR how we do, but that's the plan. Okay, so I've injected this right side, and now here is her potato salad or nice bottle of wine or whatever you want to call it that she's bringing to the party here. And look at how just nice that is. So I didn't inject anything into that area. I just blended it all. And so like when you look from here, and I'm gonna have you film from here, you just see this line. I don't know why, maybe I'm getting obsessed, but it's this line for me. I just love it. And so that is so nice. And look at how smooth that is. Remember, she had all those little discontinuities before, and then filled in her hip here. And then I did have enough to be able to give her a little bit more volume to her butt. She wanted a little bit more volume to her butt. So, she is a skinny BBL. And what a skinny BBL is, just if you don't have sufficient fat, or you just kind of on the border. So she's right on that border. Here's the fat that I have left to inject. So I've injected half of it. This kind of part here is really not usable from here down, but I'm going to inject the rest of this over into her other side, and it was enough to get the results that I wanted here, and add a little bit more to give her some volume, so it's kind of perfect. So I'm going to do the same thing on the other side, but if we just compare the two sides, so just look at this line that just goes up here. This is really, for me, this is what it's all about. all about. Look at that shape right there. That comes into the waist. We're not even talking about the key area here, but look at that. Really nice. So that's that beautiful Ogee, and that's why I tell people I just follow this line. So we're gonna do the same thing on the other side. So if you compare this line, and now let's look at this line from the same angle. Right here, this is not injected, okay? This side's not injected. Interesting, she has 2 creases here compared to the other side, she has just 1, but you know, that's pretty common. But anyway, so now let's look at the line. So this is not injected. So here, there's no fat. So you're coming here, look at how flat that is, and then it starts to come out for that saddlebag that she came in with. And then it goes back in. Whereas you compare the other side, it comes out here, continues into that love handle, into the saddlebag, and then goes right in and fills in the hip. So that's what we're gonna do now. We want this side to look like that side. So let's okay, we're finished. Looks really good. We used every little bit of her fat. She had enough to get volume projection and create this Ogee by grafting below this saddlebag, grafting above it, and now we have this really pretty shape. Looks just beautiful. Right into her nice small waist.